medical emergency, and it's a neurological emergency, and it is caused by sudden blockage in the blood vessel supplying the brain. So that results, depending on which portion of the blood supply is blocked, which blood vessel is involved, it can cause symptoms in one side of the body or the other. Typically what we say for common public to understand, we use an acronym FAST, which is facial weakness, one side or the other, mainly the facial drooping. And again, arm FAST, F is facial drooping, A is arm weakness, one side or the other, S is speech difficulty, either loss of speech or stuttering of speech or slurring of speech or not able to get the words out. And T signifies time of onset, and then also notifying time to call 911. That's the fastest and the easiest way to seek medical help. Most of the strokes technically are preventable in that if patients, we control the risk factors, main risk factors being high blood pressure, diabetes, smoking, and controlling cholesterol, eating right diet, and then exercising regularly. So those embracing the healthy lifestyle, we can prevent majority of the strokes and at least try to streamline and get on the right medications to prevent recurrent strokes. There are some modifiable factors, some are non-modifiable factors. The modifiable factors which I spoke are high blood pressure, diabetes, cholesterol control, eating a healthy diet, exercising regularly, and overall maintaining a healthy lifestyle. And non-modifiable factors are aging. So age we cannot prevent, right? So normal aging is a process. And then genetics factors, sex, we cannot change. So those are non-modifiable factors. Fortunately, yes, we are all learning what COVID, short-term, immediate, long-term effects are going to be. Technically, COVID-19 is an infection and inflammation in the body. Any inflammation can result in thickening of the blood vessels, thickening of the blood flow, resulting in slowing as well as forming blood clots. So what we have learned, at least over the past 2.5 to 3 years, patients who have major risk factors technically for stroke, typically obesity, uncontrolled diabetes, those patients come in with stroke-like symptoms, even though they get admitted with stroke symptoms, with COVID symptoms. When they develop stroke symptoms in the hospital, that's where the morbidity and additional complications from the COVID-19 augments the stroke. Despite best treatment, sometimes the recovery is very, very delayed or prolonged. Who typically have intractable migraine headaches, especially younger patients, they could develop stroke. Stroke is caused by several different mechanisms. So that's most important to understand. The stroke in the elderly people, elderly age happens because of fatty plaques accumulating in the blood vessels on top of several risk factors such as high blood pressure, diabetes, tobacco smoking, all playing additional factors to result in stroke. Stroke in the young they don't need to have these factors. So patients who have recurrent migraine headaches, they can actually tear up the blood vessels in the back of the brain that can result in stroke due to a condition called arterial dissection, which means tearing of the blood vessels. That actually can result in stroke. Again, recreational drug abuse, where it pumps up the blood pressure and the blood flow to the brain, such as amphetamines, cocaine, can result in stroke with causing blood flow blockage and chipping of the blood clots into the brain. So stroke from the elderly population is somewhat different from younger population, but it does not mean the younger population are actually going to be saved from not encountering stroke. That's a myth.
Thank you so much.
What is the treatment?
It depends on the diagnosis. So while stroke, if patients are diagnosed with stroke, we probably would want to evaluate them in detail for both the head imaging and the neck imaging, as well as with the heart testing completed. So if, as Rashida said, if it is due to a blood clot originating from the heart, typically they are treated by means of blood thinners. So blood thinners are the treatment of choice. If it is due to stroke caused by blockage in the blood vessel not originating from the heart, typically antiplatelet agents are treatment of choice. like aspirin, clopidogrel, and many other newer agents like Brilinta, which we are using dual antiplatelet agents currently in the setting of acute stroke. So it's not one size fits all. That's why it is essential that we really need patients to seek help in a timely fashion so that the cause can be identified and treatment can be tailored to the underlying condition and what is the etiology of the stroke, what is the cause of them having the stroke.